Augustus. My name's Kayla, and I'll be your nurse for today.
You can just call me Ray, please.
Okay, Ray. What brings you in today?
Well, I can't seem to catch my breath, and I can't seem to get rid of this painful cough. I've had a shortness of breath, but it seems to get better when I'm sitting. However, it's my chest that hurts when I'm coughing.
And how would you rate your pain on a scale of 1 to 10, with 10 being the worst pain you've ever experienced?
At least a +10.
And when did your pain start? How long did it last? And how often does it occur?
Well, I was diagnosed with emphysema 10 years ago, and I gotten worse to the point that I had shortness of breath when relaxing. It never been this bad, and I've had to come in many times since being diagnosed, and it seems to get worse all the time. I've started since when my 2 grandchildren came to visit me last week.
Okay. Do you mind if I take a look and I'll check your breathing?
Yeah, that's fine.
Okay, Ray, I'm going to get you to lean forward slightly with your arms on your lap. I'm going to get you to breathe from your mouth and breathe deeper than usual. If you start to get dizzy, then just stop.
Be careful to monitor the breathing throughout the examination and allow times for the person to rest and breathe normally. Be sure to warm the stethoscope first and use the flat diaphragm end piece of the stethoscope by holding it firmly on the chest wall. Listen to at least 1 full respiration in each location, which is illustrated with a red circle on Ray's shirt. While standing behind the person, listen to the posterior area of the apices at C7 to the bases and laterally from the axilla down to the 7th or 8th rib. It is important to use a sequence for side-to-side comparison. It is also important not to mistake extraneous noises that may be confused with lung pathology, such as hairy chest and the movement of hairs under the stethoscope, which could sound like crackles. It is important to visualize approximate locations of the lobes of each lung so that you correlate your findings to anatomical areas. As you listen, think about what you are hearing and what you should expect to hear. In Ray's situation, the nurse may hear some adventitious sounds, such as wheezes and rhonchi, when listening to his respirations. This is what wheezing sounds like. These sounds are produced by air being squeezed or compressed through narrow passageways. This is what rhonchi sounds like. As you may have noticed, it sounds like whistling or snoring during expiration as air passes through obstructed channels. Assess the quality of respirations. Normal relaxed breathing is automatic and effortless, regular and even produces no noise. The chest expands symmetrically with each inspiration. The symptoms of ineffective airway clearance include shallow respirations, wheezing, rhonchi, dyspnea, tachypnea, use of accessory muscles when breathing, and limited chest exertion. In addition to the basic steps of inspection, palpation, percussion, auscultation, and assessment of adventitious breath sounds, you may assess the arterial oxygen saturation with a pulse oximeter.
Okay, Ray, we're done for now. Do you have any questions?
Nope, both good.
Okay, I'll get the doctor in as soon as I can.